Thank you all for tuning in. We're super excited. This is our last Dear Doula session, probably of the year. It's been so much fun to just get together with you all and do these. So I am the doula Darcy. I have been a postpartum doula now for 10 years. And before that, before having kids, I worked for 10 years in advertising and marketing. So now I love helping doulas with the advertising, the marketing side of being a doula, which is so important in terms of getting clients. And we are today going to actually more be talking about scenarios that come up when you're actually working with clients, whether it's virtually or in the home. So this is always a very fun topic to do. So I'll let Krista introduce herself.
Hello, everyone. I'm so glad that you're all here. I'm Krista Malte. I'm an advanced postpartum doula and postpartum doula trainer with Dona International. I'm also an advanced lactation counselor and the owner of Relief Parenting Respite and Resource Center in Hampton, New Hampshire. And I've been working as a doula for almost 15 years now, and I see some familiar faces. Excited to answer questions and talk about, some of those scenarios that can be challenging to kind of figure out how to navigate through. So excited to get going.
Yeah. So the most common question that we get about this, and someone did submit it, is what to do when you're working with a mom and you suspect that she has some kind of postpartum mood disorder, whether it's postpartum depression or anxiety or OCD. Let me let you start with that one, Krista.
Sure. So yeah, this is something that, as a postpartum doula, we really always want to be assessing, right? We're always looking to screen and just say, where is everybody kind of on the spectrum of, dealing, coping with things? What are some different signs and symptoms? And if we are starting to suspect that there could be something that's interfering with someone on their like day-to-day basis, it's good to have those open conversations, right? So really practicing that active listening, those reflective listening skills, asking those open-ended questions, and really taking the time to look past certain behaviors. So, and for anybody who's taken my training, you'll mind, right? So like I put my hands up like this all the time, right? So like if this is the behavior that we're seeing, what might be driving that emotionally, right? And if we can really start to train our brains to kind of look past the behavior, see what might be driving things. Is it fear? That there's shame? Is there guilt? Is there lack of support, whatever the situation may be? That can sometimes again be an effective way of getting the most beneficial resources in place. Also, there are some really great screening tools. We want to remember as doulas, again, we're not therapists, but we certainly can use different screening tools, and Postpartum Support International has some great ones. There's one of my particular favorites is from Postpartum Progress. So I'll try and find that and put that in the chat or send it out with the recording of this video. But those are things that I like to do even prenatally, is just say, you know what, a part of my role is to make sure that everybody in the house is coping and taking care of their mental health. So I have a particular, piece of paper, a handout that I'll give to you, and we'll check in on this. And just that way, again, we're starting with the expectation that this is something that I'll be looking for, and that if there's some concern, we have, a place to talk to about it. And then that way, if there is a concern, I've already like taken away some of that barrier, right? They know what to expect. And I've also, again, just kind of destigmatized the situation. This is something that I talk with everybody about. I use this screening tool with everyone, right? It's not just about you. So, trying to do a bit of that prep work can be a helpful thing.
Yeah, and actually Diane asked about going over the do's and don'ts of the interview process. And this is something, if you do have the chance to interview with them prenatally, I always like to bring it up, like you said, Krista, and say, part of my role, like, yes, I'll do your dishes and take care of the baby so you can nap and answer your questions, but I'm also there to screen for postpartum mood disorders. And just, assess the situation, see what's going on, and offer you resources. And that's it very much always, it like gives them a door it opens the door for them to say, well, I've suffered from anxiety in the past or depression in the past, or I have a history. It gets a conversation going, and then you're talking about it before the baby's here. And like Krista said, like setting up that, your relationship. And my other favorite thing to say is because, you want to be very careful that that the client doesn't feel like you're judging them for the way they're feeling or acting. So I like to always say, like, oh my gosh, the baby is doing great, or feeding's going great, or, pick one thing that's going great and, talk about it, saying you're doing a really great job. The baby seems to be thriving. How are you doing, mom? Like, let's talk about just you. So just putting it right out there, flat out saying, you're doing a great job, but whether you say you're worried about them, but again, opening the door, giving them a chance to be like, you know what? Okay. It's, again, sets it up. Like, I'm not judging you. I'm here to help. So, and then having on hand a list of referrals, whether it's counselors that you recommend, groups, which I know during COVID is hard. Georgie asked about that. She has a client suffering right now. If in the UK, here in the US, everybody's doing telehealth. So I don't know if they're doing that in the UK, counselors. And sometimes, one thing about that is that COVID's been kind of a blessing. It's in the way that it's easier for moms to get access to counseling now because they don't have to pack the baby up. They don't have to drive 20 minutes. They don't have to park. They don't have to pack a diaper bag. They can just log on to a Zoom and get help. So it's removing a lot of those obstacles that make therapy hard.
Yes.
And also I was going to say, I can't remember. Shoot, it was good. Let's see.
While you're thinking about it, so like in the UK, I mean, I'm not as familiar again with like various parts of the world, but a great place that is usually a good line of like first starting out anyway is like just going and referring to that primary care provider or going back to their OB or their midwife who they've been working with, really encouraging them. So for instance, in the chat, I put about the postpartum progress mental health checklist. And what I love about this one so much is that it's in kind of real speak, right? And so instead of like on a traditional scale where it's like, okay, from 1 to 5, do you think you're going to kill yourself, right? That seems so intense, and that doesn't always resonate with people. And so having a tool where it's like, I'm worried all the time, or I'm really having a hard time sleeping, or I'm having scary thoughts, like it's more realistic in terms of like people's just generally, how they're talking. And then after somebody fills that out, they can bring it to any provider. It could be their GYN, their pediatrician, whoever, and they can basically just hand that over and say, listen, here, and what do I do now? And it creates much more like of a concrete tool. And so that might be a place that you could encourage your client to reach out to, is their primary care or even the pediatrician's office.
Yeah, so I think I just remembered I was going to say, I think part of our role as a postpartum doula is to help remove those obstacles for a mom who's suffering with a mood disorder, because, if you're depressed, it's super hard to go call 10 counselors and see who's taking 10 new patients, or find which ones will take your insurance. So if you could encourage a family member to do that for them, or make some calls on your own to see who is, just kind of always know who's accepting new patients. So there's as few steps as possible for her to get help. That really is a big help, and something that we can do.
Something else to consider too is that if one partner has a perinatal mental health complication, it increases the risk for their partner to also have it. So, for instance, in like with your client, if Georgie, if they have a partner, we want to make sure that we're screening for that partner too. Because very often, again, like the attention goes to like, okay, here's the critical person, as it should, but we want to make sure, again, that's one of the awesome things about our work as a doula, is to be able to make sure that everybody in the family is getting different resources. So some would ask, when do you think the mom should fill out that screening tool? I implement this in different times, sometimes not at all, really. Other times it's early, like, in the first week or so. Other times it's later, after several weeks. So, that's where I kind of, for myself anyway, I try and have that conversation prenatally if possible, to say, at some point I will, check in with you about this, right? And I keep it vague on purpose. That way I can judiciously say, hey, this is usually about the time that I like to check in. Or, hey, remember I had mentioned that, why don't we spend some time filling that out? But really, at any point, you could always just say, hey, I just discovered this new tool and I thought it would be really, a great thing to check in with everyone about. Would you be open to giving me your feedback about this? Right. So there's a number of different avenues we can always try and address the situation from.
Yeah. Awesome. As a doula in training with limited in-person training due to COVID, how do you overcome that when asked? I don't know what you mean, Diane.
Okay.
Overcome what? Oh,
can I explain? Oh,
sure.
Sorry, my dog is barking now. So I'm part of, I'm in New York, so I'm part of a collective. So when a prospective client reaches out to them, they then will give that prospective client three doula choices with a bio for each doula. So in essence, you're kind of, and whether or not the person is looking elsewhere as well. So you're kind of competing with a pool of different doulas out there. So when I asked before, like the do's and don'ts of the interview process, because now it's not like we're meeting people in person. All those meet and greets are kind of on the phone or via Zoom. And I've come into where they, not always, but some will ask like how many families you supported. So I've only supported 2 virtuals, and DONA's not really recognizing virtuals as part of certification. So even though the virtuals are really good experience and good learning experiences, I can't use them for certification purposes. But, the potential client will ask, how many families have you supported? And because it's limited right now due to COVID, how do you kind of compete with that where others may have more?
I would love to jump in if that's okay. I always really like to try and reframe things in a way that you keep it really positive, right? And so in terms of competing, Darcy and I are really big fans of collaborating, right? So I think it's awesome that you're a part of a collaborative. But when you're trying to kind of land that client, right, and be the one that they choose, it's just different. It's just different kind of experience. And so for anybody who's coming in new, and you're still trying to like just get those first clients, you're starting to get the ball rolling and whatnot, I would say just again, like portray yourself honestly and authentically, right? Like, I'm a newer doula. I've just recently come into this. I'm really excited. I have found that as a newer doula, I am, up to date on the most recent, training and research. I, I know that there's so many different ways that families can do this. And so I'm coming in with some fresh eyes and fresh perspectives, right? So like, setting, it's not necessarily about the number of families you've supported. It's more, I think, the connection and building that connection and really hearing what the needs of the family are and how you can support them and what makes you unique and what they would want to choose you for versus the actual number of families. So I'm
Yeah.
not sure if that's helpful, Diane, or if that resonates for you.
Right. And you can certainly mention, even though Donna doesn't accept those two families, you can certainly mention those two families to someone that you're interviewing with. That, I mean, that counts as a client that you've had.
Yeah,
For sure.
yeah, definitely. I have used
Oh, good.
those as resources. Yeah.
Right. So I think talking about, like, you can say things like, I'm just starting out. I've only worked with a couple families officially as a postpartum doula, but I've been a postpartum doula my whole life. I don't know if Rowan is here, she's in my postpartum doula academy, but we came up with a whole script for her. Because she was saying the same thing. She's like, I've only had a few clients. She's like, but I've been feeding babies since I was 9. I don't think Rowan's here. Anyway, so if you say something like, I was always the kid that babysat in the neighborhood, or Alia's here. She's the one, her family flies her all over the globe whenever someone in the family has a baby. Like, talk about your life experience and why you're becoming a doula, because that counts and they're going to love that story. So just talk, or, I haven't had many clients, but I had 10 kids. Like, I don't know, Diane, how many kids you have, but I remember personally, that's what I would say when I was first starting out. Like, I've only had a couple clients, but I had 3 babies in 4 years. So I know what I'm doing.
And I was on the opposite side of that. So I had been working as a doula for almost, I can never remember, 7 years, 8 years, something like that, before I had my first kids. So that for me was always really nerve-wracking to be like, oh my gosh, like, I don't have my own kids. Is that going to be a barrier for people? And what I found again is like, it's projecting that confidence and really showing who you are and what makes you unique. And really it's about them, right? It's about the family. It's not about you. It's about how can you be there to show up and support them, and really hearing what their needs are and just projecting that confidence that you can help them with what their concerns are. So I see there's another question from Liz asking about like, what are our typical routines and schedules when working with someone personally and virtually? Darcy, do you want to speak to that at all?
Sure. And I think I have a blog post about this, but anyway, my routine is I walk in, say, hey, how you doing? And I wash my hands. And then while I'm still at the sink, I get mom a glass of water and like make a show of it for any, if grandma's there, or obviously this is like pre-COVID, if grandma's there, partner's there, like, oh my gosh, mom, you must be so thirsty. I'm getting you this glass of water. And then, we chat, and you're also at that time kind of screening, like, does she look exhausted? And like, do you want to like focus on getting her to bed right away? Or is there laundry everywhere? Like, you can kind of screen and figure out what's the most pressing need for the day. But then also I let her talk about what is going on. And then I ask, like, okay, what do you need the most right now? And I always like make a joke. I'm like, it's either sleep, a shower, or food. Like, so she gets her glass of water, makes, I'm like, depending on the time of day, I'm like, do you need breakfast? Do you need lunch? Meet her needs first, and then ask her what she needs, and then start to work on that. And usually right there in the beginning of the visit, I try to get a load of laundry going, and I'll say to her, like, okay, I'm here for 4 hours. Like, before we get to me teaching you how to swaddle the baby, let's just throw in a load of laundry so that I can get that into the dryer and folded by the time I leave. So, and then from there, you just kind of do what she's asked you to do, whether it's answer all her questions or give her a nap. And I think that is about it. And go ahead, Krista.
I think a part of what is beneficial for so many families is we have like the professional understanding of how to anticipate certain needs, right? And so, that's something that I think is if you don't feel already comfortable doing that, really try and work on that the next time that you're with somebody. So kind of anticipating, oh, I see that the diapers need to be restocked. Oh, I noticed that you're running low on milk, so I'm going to start making a grocery list. Oh, like just taking away some of those like in the back of their head to do type of things. That's always a great way of just making sure that you're meeting some of their needs without having to verify with them, because oftentimes, again, parents just get this total like burnout from like decision making, right? And they feel really overwhelmed. And so keeping in mind that balance of, we don't want to assume we know what's best for our family, right? But just like, here, well, I'm going to bring over a glass of water, like Darcy said, just in case you haven't had something to drink, because it's likely you haven't had something to drink for a while, right? So kind of trying to balance some of that anticipation of needs. And then in terms of virtual support, obviously, less task oriented. I find that those virtual support sessions are generally much shorter. So if a typical in-person session was maybe 3 hours, 4 hours, something like that, that's usually different on virtual. Usually I find that like an hour consultation tends to be pretty good. And I kind of think about it as like more consultation based, because they tend to be a bit more like Q&A, right? Like checking in on like specific questions, on following up on particular concerns, making sure that there's, resources, or if there's a skill that they were working on or something. So it tends to be a bit more direct. But with any of those situations, be it in person during the day or in person overnight or virtually, our role still should look the same. Our role still remains the same about that near. At least that's the DONA international approach, right? So we nurture, educate, we assess, we refer, and that still is ongoing regardless of how we're interacting with the family.
Yeah, and I was just going to say with virtual, I kind of take my same little routine. I'll, come on, say hi, and I'll encourage mom, like, do you have a glass of water with you? Like, before we get talking, like, make sure you have that. Again, just modeling that behavior of like, meet your own needs first. And then asking her what she needs out of this session. Like, what do you need the most? The same thing, kind of setting the expectations. So obviously I can't throw in a load of laundry or watch her baby while she naps, but just kind of setting those same expectations. And and then always, like you said, Krista, running through that. It's funny, you teach the near whatever it's called, acronym. When I did my training, the acronym was, there was no acronym, but it was screen, educate, nurture, resources. So I like yours better, but that one's drilled into my head. So I'm always just going through that on a virtual session, like, screening for whatever, make sure I'm educating, make sure I'm offering resources if she needs it. That's
also, with again with any of these, I think we want to try and be mindful too that like sometimes even though we have all of these abilities, right, to like do all of these things, sometimes it's not that complicated. So just making sure we're not going in with the assumption of like, okay, today I have to do X, Y, and Z, right? We can just show up. And just by showing up either in person or virtually, like that's really valuable. And that's sometimes the biggest thing in that person's day or that person's week is just knowing, oh, okay, today, Krista's going to show up and I can just take a little breath. And I know that like there's somebody else that, and I'm not alone and I can check in. And so I was just having a conversation earlier today with a newer doula, and we were just kind of really discussing that, right? Like it's sometimes when we're doing the reading, when we're working so hard, when we're trying to make these connections, it can kind of get, we can get in our own heads about it. So just remembering you have what you need.
Right. I think that's something I did when I was first starting out. I thought I needed to be an expert and we had to cover all the topics at every session. And, you've eventually learned like sometimes a mom or a parent needs to just spend 20 minutes venting about how much or how little sleep they got last night. Like that is the thing. And they're not going to say when you ask what they need, I need to bitch about my lack of sleep. Like they're not going to say that, but sometimes they just do. And the best thing you can do is to just listen and, reflect back to them their experience. And they are thrilled. That is part of our service. It's just that listening. So I think Krista's right. We sometimes just make it a lot harder than it needs to be. All right, there's lots of great questions in here. So Lisa had a situation come up with a dad in the NICU with one twin. She was home with the mom and they asked if she would drive. In that situation, I just don't drive clients' cars. It's right in my contract. I'll ride with them if one of them, if they want me to go to an appointment or something with them, but I won't drive. I'm not, even if you got in a fender bender, like that could escalate into just a nightmare of insurance claims. Like I just don't want to deal with it. So,
agreed. That's just one of the questions too that I appreciate, Lisa, you bringing this up. So many families again are just trying to figure out the logistics, right? Especially if they have older children. And so this is a big part of like educating families about what our role is. And even though again, we can be there to help, look after older kids, or we can, take over some childcare type of stuff as they're taking their rest or whatnot. That is different than a nanny or babysitter type of role, or another care provider, so you could drive someone, but generally if you have liability insurance, that's one of the big no-nos in the liability insurance, is that you do not drive your clients anywhere, because then you're responsible if something should happen. And so in those situations in the past where I have also been asked to drive, and it can be really hard, right? Like if there's a situation and you're like, yeah, I can see how this is difficult right now. But that's one of those firm boundaries that I have that I'm not willing to budge on, is like, I understand it's really challenging. I'm just not able to drive you or your children, whoever the situation is.
And I always say like my liability insurance doesn't allow me to drive,
So what, can I just say something? So what if, this is my situation, I wrote it. What if, because what he said to me was, our insurance would cover you if anything happened.
Yeah.
That's something I generally, so this is one of those like practice of phrasing that can be challenging for doulas, for anybody really, but like just stating that's not something I'm comfortable with, right? That's not something that somebody can poke holes in. So sometimes if we try and bring in like, oh, my liability insurance doesn't cover it, or oh, your insurance would cover it, right? It's like, then you start getting into the weeds of why, right? But really what it comes down to is that's not something I'm comfortable with. That's a firm boundary, and people can't poke holes in that. They can't start to push that. They either accept it or they don't. And then that gives you information too.
Okay, because I never put it in the contract. I didn't even think about that. So we haven't had a conversation. So it ended up he wasn't late, and he ended up picking the son up. So I never ended up having to do it anyway. But I probably would have, just because they had no one to ask and just being new at this. But in the back of my head, I was not comfortable with it at all. So do you think going forward, I should just send an email to them and just say, I just want you to know going forward, if a situation like that comes again, I cannot drive.
Mm.
Yeah.
Yeah.
I always
And then,
great idea to preempt situations and like that preventative stuff. And that's why like with Darcy and I talk so frequently about like the ever evolving letter of agreement, you know, because it is those situations that you're like, oh yeah, that would be good. And I want to like get that up front, you know, next time.
yeah, and I would definitely add it to your contract. I have a link to you can purchase my postpartum doula contract template that
I just want to ask quickly, you're talking about driving their car or driving your car with their child in it. Is that right? Both of
Right.
those scenarios.
Right.
Exactly. Yeah.
Okay.
So this is a great chance to work with them on problem solving, like helping them figure out who else do you know? Is there a grandmom in the area or a friend that could go pick up the son? Can I stay here with the other twin and mom go get him? Like help them like work that muscle of logistics that you need as a parent. So, you know,
Well,
helping.
mom had just had a C-section, so she couldn't drive.
Oh yeah.
Oh,
So
good.
again, right, who in your family, who's on the emergency list that can pick up the son?
Or even like, you know, I'm assuming that, you know, whoever is there, be it a daycare or another babysitter or whoever has that 3-year-old, right? They're probably not going to just like leave the 3-year-old on the side of the road and say, okay, well, your dad's 15 minutes late, so peace out, right? That would be unlikely. And so even though, again, it can feel very much time sensitive, like, oh my gosh, like I can't, I have to get there. Somebody has to get there right now. Like that's where sometimes, again, as a doula, we can just like take that step back, as Darcy said, and just like help to problem solve and say, you know what, like, yeah, it can feel very intense, but in reality, like they're going to be okay if they're a half an hour late, you know, just apologize. So, I see that there's a question here from Janice about a client who is strictly pumping. There's no skin to skin and nursing at the breast. So in terms of your question about proceeding, Janice, could you maybe elaborate?
So actually, this is Diane. Diane and I have been chatting. And she brought this up because she didn't quite know how to proceed. And I said, I would love to know what Krista would say. So I'm going to ask you that. So her client, for whatever reason, I don't know if the baby was early or couldn't latch, or I think she was having some pain in her breast, and she felt very anxious and very nervous about putting the baby on her breast. So she asked Diane if she would come the next day and help her put the pump together, and she did. She helped her pump, and that's all she does. She strictly pumps milk, puts it in a bottle, and feeds the baby from the bottle. No actual breast feeding. And my question is, should you try to encourage her to do that? Or I know we're not supposed to be judgmental, but how do you proceed? Do you say to her, well, if that's how you feel, then we'll go with that? I mean, I wouldn't know what to say at that point.
So this is a great example of using that that BRAIN acronym. I talk about this in training, right? So BRAIN being benefits, risks, alternatives, intuition, and now. Like, when do we have to make a decision? As a doula, we, again, have access to a whole bunch of different information, resources, we understand like the benefits of things. But if it's not a priority or a problem for your client, then it shouldn't necessarily be a priority or a problem for you as the doula. And so giving parents, again, the decision about, well, you know, so for instance, with this exclusive pumping and not putting the baby to the breast, is that their goal long-term? And if not, then you can have a conversation about it, right? But for something like this, you could say, you know, how is this working for you? Is this how you'd like to kind of think about things long-term? You know, would you like to explore some of these, you know, what are the benefits to doing this? What are the risks of doing this? and go through that brain acronym. And then as the doula, just being really mindful that like it's your role to support them in making educated decisions about what's going to work for them. And if exclusive pumping is what the parent wants to do, then that's the parent's choice. And the doula is there to support them in that.
Support that.
Yeah. And this can be a really tricky situation because sometimes it happens because they just don't know how to restart it. Again, you have to kind of ask, how's this going for you? How's this feeling for you? What, is, again, finding out their goals. Because sometimes it's as easy as you just saying, oh my gosh, skin to skin would be so helpful. On the other side of that is I've worked with a couple clients who had a history of sexual assault that I didn't know about and they didn't really, obviously they knew about it, but they didn't really think it would affect them until they started to breastfeed. And I had one client, I went in and she was just like, listen, I know you're a lactation counselor. I'm not doing it. We went through this, she had a horrible experience in the hospital and she's like, I'm so sick of and she told me her story and she's like, the lactation counselors at the hospitals just kept pushing. And she's like, I don't need any more of that from you. And I was like, I was so glad she said that because I was like, okay, let's move on. So just kind of keep in the back of your mind, that might be the reason. And so you want to just, tread gently. And then, sometimes offering, like in this situation, if mom's not producing enough milk, teaching her about how skin to skin. So maybe even if she's not comfortable bringing the baby to the breast, like talked about the benefits of skin to skin for healing for them both. Like, let's have you spend some time just with baby right on your chest, like not feeding, not focused on anything, just snuggling. And, that can just be healing on so many levels. Does that answer your question?
Yes, thank you. That was excellent. Thank you. Yeah.
Yeah, we never know, right, with clients. And that's one of the things that we just always need to be very thoughtful about. People have a whole life before we walk through their door, and they're going to continue to have life after, we finish our last visit with them. And so we ideally are always trying to foster really deep connections, right? So that they feel comfortable in sharing, any and all of their experience. However, not everybody is going to feel comfortable sharing all of their experience, and that's okay too. So just, again, going back to that concept of like, if it's not a priority or a problem for them, it shouldn't be for us either.
Yeah.
Unless it's a safety issue. Sorry, I do want to caveat that. Unless there's a safety issue. And so that's a scenario that I find a lot of questions around, right? Is like, okay, well, what if as a doula we see something that isn't safe, right? So then it is our role to step in. So an example that I will give is there was a family that I had been working with, and the mom forgot something while she was changing the baby's diaper. So she walked out of the room. And so I came over and I put my hand on the baby, while he was on the changing table. And when she came back in, I sat back down and just kind of had to say, hey, you know what, like, it's unlikely that the baby would roll off the changing table at this age. However, it's always a really good, practice to start either taking the baby with you or keeping a hand on a baby every time they're in the changing station, that kind of stuff. So like, if we see something that's unsafe, it is definitely part of our role. That's that educating part. But other than that, they can make their own choices and we can support them.
Oh, let me see.
That's not always so easy though, I bet.
Yeah.
Not easy. Because I'd have to really hold back on that. I know myself, it would be really tough for me.
To address the concern?
To just say, well, okay, you're just going to give the bottle. Okay. Mm-hmm. I don't know. And I would want to educate a little bit more,
on the pumping situation.
Yeah.
Mm-hmm. And it's again, like a really, it's always important that assessing is not always just for about the family, right? It's assessing ourselves and how we're feeling and how we're interacting and approaching as doulas too. And this is part of our professional growth, right?
Mhm.
And so, you know, if we're feeling like, okay, there's something that's really, you know, coming up as like a big feeling for me, I'd invite you again to explore just your own personal reasons why, right? So like, again, behavior, underlying reasons why that's not just for our families, it can be for ourselves too. And I think that's a big part of the practice, and you don't have to be the right doula for every person. And so if there is a situation that you're really feeling like, you know what, like I just can't seem to get past whatever it is, then that indicates to me that that's probably not the right fit for you as a
Mhm.
and that's okay. There's always going to be more people having babies.
Exactly. All right. Anybody else have any burning questions? We have probably time for one more.
Yeah, and Alia just had put in
Oh.
one of the mentors doesn't take clients that don't breastfeed, and so if you have boundaries, that's okay, but pick your clients accordingly, right? And you know, in training, we discuss what are some of those really like lines in the sand for you as a doula, and if you haven't thought about that, what are some situations that you would feel really uncomfortable in, or what are some situations that you would really have a lot of judgment around? I encourage you to do that, so that way, again, you can start to screen as early in the process with a family as possible, so that way, again, in a non-judgmental way, you can make sure that you back out, or that you just don't accept working with that family, but doing it in a way that makes sure that they're not feeling judged.
Right.
I've had to remind myself many times, it's not about me.
Right.
The job is not about me, it's about them. And using that brain acronym is great, because it's like, is it doing it? And also, is it doing harm? Is there any harm to the baby if the baby's just getting milk from the bottle? You know, like, is the baby safe? Is he or she being well taken care of? Are all the needs being met? And if the answer is yes to those questions, then you really have to step aside and realize that it's nothing to do with you. It's all about the mom and the family.
Right. And it sometimes is so, I think that's one of the hardest things about being a postpartum doula, is that you kind of have to come to the realization that everybody's on their own path, everybody's having their own journey, and you can help them, but you can't necessarily save them from all the pitfalls of, you know, the postpartum period. Like, you know, life just happens. So you can be there and you can be supportive. And I don't know why, but this kind of situation always kind of makes me think of that quote by Maya Angelou about, like, people don't remember what you said, but they remember how you made them feel. I think that is so tied up in what we do as postpartum doulas. Like, our ultimate role is to be supportive, and we want these moms to remember feeling supported by us. And so that is, you know, that means sometimes we have to just smile and keep going and not, you know, and not judge. So it is tricky. It can be really tricky in certain situations. So, but these are great. So I love all the questions that you guys submitted. This was a great conversation. Another good postpartum doula party. Oh, Lisa, you can purchase the contract right on that link, just that I just put a few things up.
And
yeah,
I just
so
in the chat a link to my postpartum doula trainings. If you have not already taken a postpartum doula training, I have a variety of those coming up in the next several months. We also, if you are trained and you're working through your certification process, I have an 8-week program that's going to be starting in January, helping to, again, just provide some clear mentorship and accountability through those certification requirements. And so
It's a great class. I took it.
thank you, Janice.
It's
Yeah.
excellent. And before you go, Krista, I have a question before you go. A lactation consultant question that I've been asked twice, and I don't know if I gave the correct answer, so I need to ask you.
All right, go for it.
So both the moms that I've worked with, and I haven't seen this happen, but they tell me that when it's around like between the hours of 5 and 8 p.m. when the baby is hungry and the baby's crying, they want to feed the baby. The baby doesn't latch, is inconsolable, is screaming. They can't get the baby on the breast. And I told them that I thought that perhaps it was they didn't see the signs that the baby was hungry early enough, and to look for those signs, and that the baby was like beyond the point of no return. And they just couldn't settle the baby down to even latch on. So
That's great.
is that right?
Yeah, I think that's great advice. In terms of like right and wrong, I think it can be handled so many different ways, but I think that that's a great approach, right?
Yeah.
So trying to, again, lots of just that near acronym, right? Nurturing. Yeah, that is such a hard situation. This is, really common, right? And then like just moving through that, right? So that educating, hey, here are some, different cues. Here's some different ways.
Yeah. That's what I thought too.
And those are really common scenarios. And so that time is often, referred to as like the witching hour.
Yeah.
Though it's never an hour, it's usually a period of time. And so, trying to anticipate that and put some strategies in place to minimize that is always
Both of them were like, we couldn't get our babies to stop crying. We didn't know what to do. She just kept screaming. She wouldn't take my breast. And I said, why don't you try to change her position, walk her around a little bit and try to settle her down, rock her.
And those are all great approaches, definitely. And so as doulas, we, that's part of our role,
Okay,
right? Trying to get a little bit from everything.
Yeah.
So,
Thank you.
Yeah, you're welcome. Thank you everyone so much for attending, and wishing you all very healthy, happy holiday seasons. Darcy and I, it's our last Dear Doulas for the year. So we'll be seeing you on the flip side.
Yes, and I just posted a link. If you love these little doula parties, feel free to please join my new membership for doulas. It's called My Doula Village, and it's we're the women of the village helping the women of the village, and I think we need a village. So it's part like calls like this, like answering questions and talking through scenarios, but also marketing advice from me, and we've got monthly.
It's a nice forum. It's nice. It's really nice.
So and I'm still building it right now, so I'm looking for founding members to give feedback and help me just create the best membership for doulas. So Janice is in there. It's been pretty fun so far, and I'd love to have you guys join. So if you have any questions about it, just shoot me a message on Facebook or Instagram or email or whatever. But happy Thanksgiving if you're in the US. Happy holidays, and we'll be back. I'm sure we have to schedule it, Krista, but I'm sure we have some Dear Doulas planned for 2021. And yes, the village is available to Academy members. I will shoot you the link if you want. So,
all right, keep well, everyone. Take care. Bye-bye.